Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Wynn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, and welcome to this episode of the Healthcare Connections podcast. I am your host, Jeremy Wynn, the Director of Sales here at Healthcare Compliance Pros. I'm really excited for you to meet this fun and energetic guest today. We've got Jessica Jones. She is the founder and CEO of Build Your Cash Medical Practice. Welcome, Jessica.
Thank you so much for having me. I'm excited to be here.
Yeah, I would love for the listeners to get a better understanding of your background. You've got an amazing story. So go ahead and give us a better introduction than what I could do in that short 5 seconds.
Sure. I know it's such a brief amount of time that we're together, so I'll give you the really quick summary. I had built a reputation for helping medical practices grow and was helping a lot of physicians go from struggling to success. And one of my clients asked me to partner with him. And so from 2012 to 2017, I owned and operated 21 medical practices all across the country. In 2017, the last of those sold off. And I said, I never really went into this to own practices, and I went back to consulting, and I've been consulting ever since.
Very cool. Yeah, I love that. And I know, as you said, you're keeping it brief because, seeing what I know about you and in your bio, there's so much more you could say. But I love at least that high level for our listeners. I appreciate that. So you've got this reputation of helping drive additional profit to practices. So I wanted to bring you on and let you talk about some of the top strategies that you've seen, that you've put into place for practices that have helped them find that additional cash and in turn lead to more profit.
Sure. And it really is individual. It's about what specialty you're already in and what your passion is. So the first thing I do is, start focusing on what the passion is. And then the other thing is, with regulatory changes and new things coming out, it also changes with those things. So most recently, of course, with the change in GLP-1s, we're doing a lot of help to med spas about what to do and add. You should never have just one focus of profit stream, right? There should always be multiple things that you've got for your patients. And then, of course, wound care is very big right now. So I'm doing a lot of med spas and a lot of helping people add wound care to their practice.
That's awesome. And so
in a compliant manner,
in a compliant manner, which
that's
is
the big thing with wound care. You gotta do it the right way.
Yeah.
Yeah.
And you mentioned in a compliant manner, that is a big deal. Anytime you're looking to add additional services and maybe they're slightly, I wouldn't say outside of scope, because that always gets a little dangerous when you're getting outside of scope, but it's something that makes sense and it is within your scope, but it's something new to you. It is important to have somebody, like yourself, Jessica, who has done this, that can say, hey, okay, so you want to add GLP-1s or you want to add wound care to your practice. Let's do it the right way. Because, I can tell you, wound care specifically has really had a microscope on it over the last couple of years. We've unfortunately had people come to us that aren't even clients that have said, hey, I'm getting audited for all of my billing practices, and everything I've submitted for wound care, and they're getting clawbacks like crazy. So it is important to do it the right way.
Yeah. And one thing I will say, it's really important to have an expert, a billing team that has an expertise in chronic wound care, because it is very specific and very specialized.
Absolutely.
Yeah.
So talk to me about, some of the specialties that you're seeing. And again, we can go beyond GLP-1s and wound care. But what are some of the specialties that you're seeing maybe the most interest, that are looking at and seeing opportunities in some of these additional revenue streams?
It's funny because it really does run the gamut, and I know I'm sure you're seeing the same thing, but I have, everything from cardiologists and orthopedic surgeons to chiropractors, and even dentists recently have come out and sort of said, "Hey, what can I do in my practice, because, either I have all these off hours that I can use my space for something else, or I can bring somebody in." Um, uh, Definitely the other space that's really I've seen a lot of is mental health specialists. So it, like I said, it kind of runs the gamut, but those are the kind of the top ones that I've been working with a lot.
Interesting. Yeah, the mental health space. Yeah, dive into that a little bit more. I'm just curious, as they're looking to again increase profit, what are some things you're
Hmm.
seeing in that space? That's an interesting one.
Yeah, so for the mental health space, I've seen a lot of practitioners, first of all, want to switch from insurance to cash.
Okay.
Um, and I've also worked with a lot who are saying, what can I add here to branch out from just therapy or medicine management? And so I've found some really cool devices that are tested and proven and work very well to add a revenue stream with that patient base that's already there. And then you extend beyond the patient base to marketing, and you've got, a whole new practice basically. And the benefit of some of these devices is the practitioners, overseeing the device, but it doesn't need to be uh, done by a medical specialist. It just needs to be done by a certified trained person on the device. So it also adds revenue that isn't solely based on the practitioner's time, which is another huge thing that I work with practitioners on. So many practitioners are so tied because they're the ones that are doing everything, and it's kind of
Mhm.
helping them do things that they don't have to do to make money from.
Absolutely. Yeah.
Yeah.
I love that. Are there some of those? So you mentioned a lot of them are trying to find ways to get more cash based
Hmm.
services. Are there some of those services, you talk about some of these machines, equipment, et
Yeah.
cetera, that are also, they can be billed to insurance, but also
Absolutely.
are
Absolutely.
cash
In
based.
fact, the same device can be billed to insurance, or you can charge cash for it.
So gives you a lot of flexibility in the practice when
Yes,
you do that.
exactly. And for the specialists that are in the field, it's it's really great because it adds a huge opportunity for their patients, and they see results. I mean, these devices aren't just, oh, this is a way to add money. It actually, also a way to improve your patient's outcome, right? And so it's exciting across the board. Yeah.
Yeah, I love that. Let's talk about dental a little bit. Maybe dive a little bit deeper on the dental side because we're seeing, whether it's adding aesthetics or capitalizing on. I was talking to somebody the other day. In fact, I have somebody that'll be on the podcast here in a couple weeks, but talking about ways to utilize extra space. But
Yeah.
let's focus on dental a little bit. What are some of the best strategies you've seen?
It's so funny. We've got a lot in common, it seems like. But I actually have worked with dentists who rent their space out to, functional medicine or practitioners, and I have
Mhm.
dentists who add a functional medicine person within the practice, or wellness, or IV therapy and Botox, not via them, of course, all within the scope of practice. So that's something else we talk about, but it's a lot of utilizing the space to add in aesthetic devices, and then some people bringing other people in to use a free office or whatever to increase their revenue by bringing in another expertise, which also brings patient foot traffic, which brings benefit to both parties.
Oh, I love that.
Yeah. Yeah.
So I would say, and this can be kind of specialty agnostic, but let's say there's, somebody that's, saying, okay, I need more profit. I need more cash. If they were to talk to you, and again, this can be very general, they
Yeah.
find Jessica and, what is there a top one or two things that you usually start with, as you start working with a group?
I gotta be honest with you. No, the first thing I start with is, what are you passionate about? Because if you add something to your practice just for money, it's not going to work. You have to believe in what you're doing and be able to honestly and enthusiastically present it to your patients. And so if you're adding something that you don't believe in or that you're just doing for the money, it doesn't work. And so the first thing is always like, I have to learn about who they are, their practice, their patient population, and then we talk
Hmm.
about, okay, now if you call me and you say, I'm a vein specialist. I'm looking to add things to my practice. That's easy. It's like, okay, you're a vein specialist. You should be doing wound care if you're not already, right?
Hmm. Yeah.
um, and if you're a med spa, there's not one device. Again, you have to believe in what you're doing, but there's certainly a list of devices that I go through that they may or may not have. I got to be honest with you, sometimes to grow revenue, I talk about also removing devices, especially
Hmm.
from med spas where they're just overwhelmed with equipment and it's taking up like we talk about, well, how much time does it take to set up the patient on the equipment and then clean the equipment and do all this, and what could be done if you had that time back, right?
Yeah.
So sometimes it's offboarding instead of adding.
Yeah, I think in our experience with med spa and aesthetics, as we go to the different shows as a vendor and talk about,
Mhm.
helping them with compliance. Of course, we see all the other vendors out there. I've never seen an industry with more shiny new toys than the med spa and
Yes.
aesthetic space. And it's
You know what?
fascinating and it's fun and it's interesting to
Yeah.
see all these things, but I can see, to your point, how
Yeah.
it's so easy to get caught up in the shiny new toys.
I hate to say it. I've seen so many successful practices buy into a device and then call me to get out from under, right?
Yeah.
Like, I'm dying. I'm not making the money. The patients aren't buying it. I don't know what to do. I have this 5-year lease on this equipment that's like a
Yes.
mortgage. And it's, you know, so one thing I will say, if you're thinking about a device, go to Groupon and see how many people are selling it for, and what they're selling it for. It really is. I hate to say it, but it's an indicator of, okay,
Yeah.
what's out there with this device that
And
essentially I'm going to be competing with.
yeah, and a lot of times, if it's on Groupon, it means that they're not getting the traffic to that device that they needed, and so it's also a good indicator. They're just trying to get more and more people to it because it's not quite working. So I love that. That's great advice.
Yeah, they've got to resort to group. It's really a strong indicator of, maybe this isn't the device I should be investing in for my practice. There's so many great things and there's so many unique things. You can set yourself apart. It's another reason, I mean, I love functional medicine. It's something that people are really excited about and looking for, and and there's not a lot of people who are really experts in it yet.
Hmm.
It's not like something where there's a lot of options for patients. So the patient looking for that, you can set yourself apart by getting into that space.
Love that.
Knowledge is power, and you don't always need equipment. You need expertise and
Yes.
a specific, like I'm in Pennsylvania. Tick-borne illness is huge here. So people
Yeah.
want a tick-borne illness specialist. That's an expertise. That's a cash pay, because where are you going to find it? And there's
Right.
so many different things related to tick-borne illness that you can do that are just great, and people need it, and it's a win-win.
Hmm.
Win for the patient, win for the practitioner.
So, I mean, as a consultant for these groups, you can come in and let's just, med spa, for example, since we're on that
Yeah.
topic, and it's like, okay, you have these providers. um, where is the most revenue per hour? What treatments, what things can they be doing that's actually going to drive the revenue that has a high demand? And so I think that's wise to be able to have somebody like yourself that is seeing this at other clinics and other
Yeah.
spas and saying, okay, look, what you're going to make per hour with these treatments for your providers and the efficiency of getting people through, that's how you're going to grow profit rather than
Yeah.
you know relying on, I'm going to buy this shiny toy and people will come
Yeah.
to it.
Absolutely. In fact, there's another consultant that I work with very well. She does kind of the big picture overall branding piece of a practice, where I do the implementation and nitty-gritty of what's going to work and how do I do it. And we're actually doing a med spa makeover program together, because there
Oh,
are
very cool.
so many med spas that were so focused on GLP-1s who are feeling like they need to go out of business, and they don't need to go out of business. They need to reset and, do all of these things to set themselves apart and implement the right things, remove the things that aren't working, and not get so scared of the regulatory changes.
Absolutely.
Ironically, same with wound care. Wound care, everybody's talking about, oh, there's going to be a change. There's going to be a change. It is always going to be a great space to be in. If you're doing it the right way, you're healing wounds, it's always going to be a great business. And when I see people scrambling to get out of it, I say it's great because the right people are going to stay in it and do really well.
Yep. Yeah.
But if you aren't doing it compliantly, or you're doing it the wrong way and you're not following the guidelines, please get out. Go.
And if you don't get out, eventually you're going to get audited and it's going to force you out.
Yes. Callbacks. So, the people looking at those files are paid on a commission on what comes back in the callback.
Yes.
So they are going to find anything you've done incorrectly. So you got to button it up
Once their foot's in the
and do it
door,
the right way.
yeah, once their foot is in the door and they've found some opportunities for clawback, they'll keep digging and digging.
Yeah.
That we've certainly learned that as we've helped people through that unfortunate, not so
Yeah.
fun time. So I think that's a great lead in, Jessica, as you talk about this, this makeover program, Med Spa Makeover.
Yeah.
For anybody that's interested in working with you, even talking with you and sharing their current situation and seeing if there's some opportunities to improve, what's the best way to get a hold of you?
Yes, I'm so simple. Like if you just go to my website, www.buildyourcashmedicalpractice.com, you can book a free half hour with me. And my goal is to share as much as I can in that 30 minutes so that you walk away with at least 2 or 3 things that you can implement right away. And then themedspamakeover.com is that program for med spas that'll be coming out in August, which is probably now.
Yeah, as I
So
say, yeah, we're a week away from August as
yes.
of
So
recording,
if you're listening to this podcast, it's out.
it's going to be August when we release it. Okay.
Yeah.
Jessica, thank you so much. Really fun to have you on. I appreciate it. You're doing a lot of great things for people, and I know hopefully some people listening to this will take advantage of that and have the opportunity to learn from you on how to become more profitable.
Thank you so much. I'm really honored to be here, and I'm so grateful to be connected with you.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.